Director of the Faculty of Psychology and Education Sciences, University of Porto, and the past President of the World Association of Sexual Health. Pedro is a very reputed, respectable researcher and professor in sexual health and sexuality and psychology, not only in Europe, but globally. And today he will be talking to us about why sexual health matters, the role of sexual health in global health and well-being. Pedro?
Good afternoon. Can you hear me?
Yes, go ahead.
Can you hear me? Okay. So I think I cannot start my video. I think it's centralized. Now, yes. Good afternoon. Can you hear me well? Can you hear me well?
Yes, we can hear you
Yes,
very well,
okay.
Professor.
So, thank you very much. Let me just start by thank you very much for inviting me. And I should apologize because today was a very special day at my university. It was the anniversary of the University of Porto. There was a huge celebration, so I was not able to join in time. So my apologies for that. I will make all efforts to compensate that. Thank you very much. Before starting sharing slides, let me just say briefly that how honored I am to be part of this series of talks on human sexuality, on sexual health and sexual rights. I think this is a very important topic, of course, and I'm very glad that the American University of Beirut, the WISH program, and the Asfar Institute are moving forward with this very important series of talks on this important topic. So thank you very much for that. And I also want to thank you to my colleague, esteemed colleague and friend, Professor Faisal Al-Kak, whom I know for a long time right now. We've been involved in many different projects, both at the World Association for Sexual Health, but also at WHO and other dimensions. So I'm very glad to be here with you and sharing with you all. Also, let me just say that I'm proud to be also sharing with the university that is a symbol of diversity, as far as I know, in the Middle East, but also in the Arab world and broad and in the broader context. I think it's very important. I wish I was there in person. I hope that maybe in the future I could be there in person. So thank you very much. A country which is known for its diversity in very different levels. So I think this is also very linked to the topic of my talk today with sexual health and sexual rights and why does that matter. So am I able to share my screen? What is the best? What do you advise? Share screen, or do you have any other suggestion for me to do?
You can share the screen if you want, or we can share it for you.
It's up to, if I share, I'm able to change the slides easier, maybe, no?
Yes.
Okay, let's try. Let's see if I can do this. Can you see my slides?
Yes.
Okay, so let's see. Now, like this. So you see the slides, correct?
Yes, clear.
Okay, so as Professor Faisal said, my talk will be on why sexual health matters, the role of sexual health in global health and well-being. So actually the idea is, what do we know what we know about association, what is the scientific evidence about the role of sexual health in global health, being it physically, socially, psychological, or any aspect of dimension of global health and well-being. And I just wanted to start by sharing you the definition of sexual health to begin with. And actually, it's interesting to see that one of the first meetings that was held by the WHO World Health Organization was 50 years ago, in 1974. There was a special meeting with a committee of experts to discuss dimensions of sexual health, and specifically education and treatment in human sexuality. And afterwards, a few years afterward, there was also, at the beginning of this century already, another very important meeting with different experts all over the world, some of them also belonging to the World Association for Sexual Health, that joined together to discuss and present a definition of sexual health. So what is sexual health? And interestingly, sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. So this first phrase is important because it sets the stage for these different multidisciplinary dimensions. It's not just physical health, but it's emotional, it's mental, and it's social. And also, it's not merely the absence of disease or dysfunction, and requires a positive approach to sexuality. So this is also a very important dimension, the positivity approach to sexuality, and the possibility of having pleasurable and safe sexual experiences. So pleasure was already over 20 years ago also at the definition of sexual health, the ability or the possibility or the right, I would add, to have pleasurable sexual experiences. And of course, free of coercion, discrimination, and violence. So as you can see, there's a lot of dimensions here on this definition, but I would emphasize the multidimensionality, the fact that it needs a positive approach. It's not just merely the absence of problems, and the ability to have pleasure, and of course the rights of people in terms of not being discriminated or target of violence or free of coercion. And if we now look at the relationship between this definition, this broader definition of sexual health and rights, we can see that this sexual health is actually strongly linked with several sustainable development goals. I emphasize here a few of them, but if we could even see more associations with some of the others. But for sure, good health and well-being, quality education, gender equality, reduced inequalities, and also peace, justice, and strong institutions are all sustainable development goals that are linked in some way with sexual rights and sexual health. So what I will now briefly share is what is some recent evidence based on, of course, scientific evidence, published studies on the association between sexual health and global health, well-being, and actually also quality of life. What we know about this and what is the latest evidence. And I'm just sharing a few studies, but studies that are very important on one way because they are relatively new. I'll share studies from the last 4 or 5 years, but also because they are, most of them used longitudinal designs or prospective designs, which mean they could give us a sense of causality, or at least some relationship that is causal in terms of temporal causality between the dimensions, which is also very important. And the first study I want to share is this study was the association between lack of sexual interest and all-cause mortality. This was conducted in Japan, in the general population, and was a prospective observational study, so longitudinal study, and studied the associations between sexual interest and all-cause mortality in over 20,000 participants. So it's a very big sample, over 40 years old, who participated in annual health checkups during, I think, 10 years. What we can see in this slide is actually the differences between individuals who had sexual interest at time point 1 or lack of sexual interest at time point 1, and the possibility of survival rate during 10 years. So what you see on this specific graphic, this is the one respected to the study in men. What it shows is that men with higher sexual interest at the beginning of the study, compared to the ones who had lack of sexual interest at the beginning of the study, they do tend to have higher or less risk factors for all-cause mortality. So in a way, men with higher sexual interests were less vulnerable to all-cause mortality in Japanese males over 10 years period. Interestingly, this was not found in women, which also raises the question of differences in genders. But in a way, this was a very important study, very recent study, longitudinal, with a very big sample, indicating that sexual interest is a risk factor for all-cause mortality, or on the other, if you look at the positive perspective, sexual interest is a protective factor in terms of all-cause mortality. A second study, which was also a longitudinal study, this was the longitudinal aging study in Amsterdam in the Netherlands, relatively different, but also including, in this particular case, not sexual interest, but enjoyment of sexuality. So, and what they found is that enjoyment of sexuality was associated with longevity in older adults, and this was not different from men and women, but was different specifically, particularly for those who perceived sexuality as important. So in other words, if you look at the graphic here, you see for the ones, regardless of gender, who perceived sexuality as important, enjoyment of sexuality was an important factor predicting life expectancy over in people over 65 years. So it means that the more you enjoy your sexuality, the more longevity you have, particularly if you find sexuality important in your life. So this is also an important finding. Another study, national representative study, again longitudinal in German aging survey, found that sexual satisfaction was consistently associated with lower number of physical illnesses, with better self-rated health, and also with absence of depression. So again, a positive sexual health dimension, which is sexual satisfaction, is in a way a protective factor in terms of physical illnesses, self-rated health, and actually also an important aspect of mental health that we all know it's one of the major causes of not only health problems, but also social and economic problems at the global context, so depression. There was also a systematic review, recent systematic review. I was involved, I was co-author in this review. It was published in the Pan American Journal of Public Health. And the systematic review reviewed all the studies published on the association between sexual health and subjective well-being in older adults. And we found 15 quantitative studies. And the majority, overall, what the findings suggest is that living a fulfilling sexual life is an essential component of subjective well-being. So again, overall, the importance of sexual health dimensions, and in this particular case, subjective well-being, self-reported, of course, in this study. There was also another longitudinal study, again, the German aging study, that found positive correlation between sexual satisfaction and life satisfaction, as well as positive affect, and the negative correlation with negative affect. So again, all of those studies indicate or suggest that sexual health indicators are important, not only for global health, but also for self-reported well-being. And finally, a study, again, with sexual satisfaction, indicating a strong correlation with a number of quality of life outcomes in men, particularly in interpersonal aspects of sexuality, and in women, particularly on interpersonal factors related to quality of life. So, but regardless of that gender differences, both in men and women, sexual satisfaction was an important predictor of quality of life of men and women. And so, with this background, we recently actually conducted a study also in Portugal, which I'm going to present preliminary findings to you. This was a survey based on the WHO new measure. I will briefly present right away. It's called the SHAPE, the WHO Sexual Health Assessment of Practices and Experiences. In Portugal, we were the first country to use the new questionnaire, the new survey, to collect data at the country level. This is part of our previous project that we were conducting. If you are interested in knowing more about this WHO survey, you can actually copy this QR code and you'll have direct access to the questionnaire itself. I would actually strongly encourage all of you who are interested in doing research, in collecting data on sexual health indicators that have an important impact on people's life, to use this questionnaire and promote this questionnaire, because it will, with this kind of survey, we are able to collect data in different points of the world that could be comparable. And I think this is one of the major the most important aspects of this survey, that we could be able to do the studies that can be comparable. And we do have, fortunately, there's a lot of research in all of these dimensions, but there's less and less comparable studies, and this is a way to move forward and close that gap. So the questionnaire has a number of sections: socio-demographic, questions about sexual health, sexual biography, also sexual practices, and also questions about social perceptions and beliefs, identity, and rights. In Portugal, we added an additional section to assess specific sexual problems, sexual dysfunction, sexual pain, also indicators of global health and quality of life. So the good thing about this survey is that you can add more sections that you feel are important to do your own research, to the ones that already are the basic common ground of the questionnaire. So we had a representative sample of older people older than 18, so adults, ranging from 18 years old to 95. So you see, we cover all different ages, a mean age of around 50 years. So this was quite representative of the Portuguese population. Over 2,000 questionnaires, mostly using online surveys, but also around 30% using a telephone interview, in order to find people that have less access, of course, to online surveys. Relatively balanced in terms of genders. Some people indicating that they have some sort of intersex. This was self-reported, but even though a number that surprised us, 3.6% indicated or reported having some form of intersex, and we are looking at that data also in detail. Just to share with you the distribution of the main dimensions that we assessed, self-reported or self-perceived health, global health, and mental health, two of the most important indicators. And you can see a very close to normal curve in both dimensions. We also assessed quality of life and satisfaction with life. Again, all these two dimensions were relatively normal distributions. Sexual satisfaction and pleasure, again, relatively normal distribution for sexual satisfaction, less for pleasure. Interestingly, and a little bit unexpectedly, more people saying that they have unpleasurable sexual experiences compared to the ones who said they have pleasurable sexual experiences. So we are also trying to understand better what is happening with this sample and why did they report having less pleasurable sexual experiences in a large amount. But we are, as I said, particularly interested in associations between sexual health and global health and well-being. And so what we did was very simple. We did correlation analysis, zero-order correlations between sexual satisfaction and sexual pleasure, and also perceived health and self-perceived global mental health. And as you can see, although the correlations for perceived mental health were not high, were relatively low, but all of those were positive and statistically significant, meaning that sexual satisfaction and sexual pleasure are associated, significantly associated with perceived health and also with perceived mental health. When it comes to well-being, quality of life, and life satisfaction, we again see positive and statistically significant correlations, not as, again, relatively low, but still positive and statistically significant, indicating or suggesting that sexual pleasure and satisfaction are associated with quality of life and with life satisfaction. We also studied or included sexual dysfunction and sexual distress. This was the additional questions that we introduced to the WHO survey. This is not included in the original survey, but for us was very important to study sexual distress and sexual dysfunctions. And here we see a relatively interesting pattern. On one end, we see what was expected. So not only sexual distress, but also all the other sexual problems were negatively correlated with mental health. But surprisingly, besides distress, which was negatively also correlated with perceived health, there was positive correlations, although very low, of course, but still positive correlations with perceived health, which is intriguing in a way, and we are trying to understand why that happened also. And finally, relationship association between sexual dysfunction and quality of life and life satisfaction. And here again, as expected, we see clear negative and significant correlations between sexual distress and sexual dysfunctions with quality of life and with life satisfaction. So to sum up this studies, what we see is that recent evidence suggests, of course, that sexual health is associated with global health, with all-cause mortality, with longevity, also with number of physical illnesses and with depression, and also associated with well-being, subjective well-being, life satisfaction, positive affect, quality of life. And with our study, with our preliminary findings, we can also, in a way, support this, showing that sexual well-being, particularly pleasure and satisfaction, and sexual problems are associated with perceived physical, mental, and global well-being. So, in terms of what can we take from here? What are the impact of this? What are the consequences of this cumulative evidence. I think there's two main points. One is that if we are able to strongly affirm with scientific evidence that sexual health indicators are strongly correlated with well-being and global health, then we can also firmly suggest that sexual health should receive public health attention and access to care. And as many of you may know, unfortunately, sexual health is not usually at the top of the priorities. I would say that usually is, of course, something that is underrepresented. And so we should be able to strongly emphasize what the scientific evidence is there to support the importance of sexual health. And the other aspect is, of course, the public policies. If sexual health is a core dimensions of global health and well-being, then public policy should consider promoting sexual health and well-being as important dimensions of those global health and well-being. So not only in the perspective of access to care, but also in the perspective of putting sexual health also at the core of interventions to promote global health and well-being. I would like to take this opportunity also to share briefly. I know that I probably don't have much more time, but just to say that we at the University of Porto, we are happy to have a number of facilities, including a sex lab. For the ones who are interested in knowing, you could actually also copy our QR code and you have access to our website and know what we are doing in the lab. We have a number of different research lines, including, of course, what I've just been talking, broader aspects or dimensions of sexual health and well-being, but also basic processes and psychological basic processes that we can study in the lab. We also study sexual violence, the diverse sexual preferences, and we are now more and more into chronic problems, cancer, sexuality and well-being, aging, and also interventions, psychological interventions and e-health interventions to promote health and well-being. The team is becoming bigger and bigger. We are actually right now almost celebrating the 15 years of the sex lab. As you can see here, a number of young and most young generation, mostly composed by women. I think this is also important to note that in Portugal at least, and I think in many countries in the world, the young generation of researchers are mostly women, which is very also important to emphasize. Here I have a video. You could actually have access to the video through the QR code. It's a video of what we do in the lab, what can we do in the lab, and what are the implications of the studies that are conducted in the lab. So trying to explain why or how is it possible to transfer studies in a lab setting to the real world and that have impact to people's life. And that's what we actually do. We also do studies using fMRI, brain imaging studies, and a study during the pandemic, which was very important to test the role of psychological dimensions in predicting sexual problems. And also just to share a very interesting study that we did in collaboration with Max Planck Institute in Germany. This was a study in our lab that was trying to understand if there were specific components, chemical components of our breathing that could be associated or indicate or could be indicators of sexual arousal. So love is in the air. It's a very interesting way to put it, so that the way we breathe or the chemical components of our breaths are found to be associated at some point with our sexual response in the lab, which is also very interesting to share with you. To finalize, what are we doing right now? As I said, a number of studies that are testing digital interventions, psychological intervention, but using digital methods and tools to promote sexual health and well-being in patients with cancer, in older populations, also in prostate cancer survivors. We do also have a very important study on a different area aimed to prevent or reduce the child sexual abuse by promoting intervention with people who ask for help. So in a way, this is also very interesting. There's a program to prevent child sexual abuse. We also have a doctoral program in human sexuality. We welcome all people interested. International students are a part of our DNA. So if you are interested or willing, please apply or please share. And a final word related to the World Association for Sexual Health. I've been privileged to be in the past president of this fantastic international organization. Faisal is also a respected member, is actually now the president of the new Middle East Federation, and the World Association is a home for everyone who are working not only from the perspective of the scientific perspective, but also from the professional perspective and the advocacy perspective. So it's an organization that is open and welcomes everyone and fights for the sexual rights of everyone everywhere. The next conference will be next year, actually, in Brisbane, Australia, and I encourage you all to be there and to meet us. So thank you very much for your time. And again, sorry for starting late.
Thank you very much, Pedro, for this very interesting presentation. Although I know some of the data, but this is really, some are new to me, and it's really interesting. I also want to congratulate you for the fantastic work you're doing in the department, in the university, with all these great ideas, and I really look forward for collaboration on many aspects. Back to the study, Fatima, is there any questions? Because I have some questions. Any questions in the chat or in the QA? Is there any explanation, because you really situated very well and you positioned very well the sexual health within the global health and well-being, which aligns with SDGs 2030 and the WAS vision and the WHO vision. But back to the study in Japan, did you have any interpretation on why it matters for males more than females? Is it because the female sexuality is being, like, socialized to repress it or not to feel it's important versus the male one? Is there an explanation that you would like to give in that respect?
Well, thank you very much. First, let me just say thank you, Faisal, for making the. Let me just say that regarding this specific question, of course, there is definitely, as I would say, an important role of culture, of beliefs, of attitudes, and of course, when it comes to gender, in many countries, and I would say across the globe, there is unfortunately still a gap in different aspects in terms of rights of sexual health for men and women, and of course in terms of what I would say this study was, of course, self-reported, so people would say how important is for you sexual health in one of the studies, or sexuality on the other study that was not asked. But I would say, in terms of trying to understand this difference in terms of gender in the Japanese study, is that probably this is clearly related with gender stereotypes regarding sexuality in one way, so beliefs about sexuality and the importance of sexuality, which is, it's again related to beliefs. So of course, cultural aspects and repression, as you said, which again is still very different for men and women. The double standard is still very strongly imposed in many countries, in many regions. I would think that this is probably the main reason for that difference. Interestingly, in the other study where there were no, at least no reported gender differences, was a relatively similar study in terms of longevity, but again was conducted in Amsterdam, if I'm not mistaken. The main difference was not related with gender, but related to how important is sexuality for you. So I would say that probably those two aspects are connected. Of course, for women, if that dimension of life is very important, I would say definitely, again, this will impact their life, their well-being for sure, and actually probably their even longevity, as the study suggests. So not sure if I was reply to, but that's are my thoughts on that aspect. So to summarize, I think that beliefs are still a very important dimension.
Okay.
And of course, beliefs are interpersonal, but they come from cultural dimensions, and this is still a major aspect over the world. Well, there's gender imbalance.
Thank you. I have another question from Ms. Lina Abu Habib. Lina?
Thank you, Faisal. Thank you, Dr. Nobre, for this. Can we go back to your slide about research questions, or framing research questions before?
Which one exactly do you?
Before the yeah.
So
Yeah. No, wait. Can you fast forward again? Yes, this one. Yeah.
Okay.
And I think this is interesting because as you were talking, I was thinking about because I mean, Faisal would know, I don't think we have much empirical research on this topic in the Swana region, at least not produced by academia. But I was thinking whether you are aware or what you think about investigating sexual health in a context of ongoing conflict and continuous forced migration. And I'm reflecting on an initiative that Faisal led and in which I was involved, in the way Syrian refugee or women refugees from Syria define their sexual and reproductive health, and the ways in which they defined abuse and violence. And I was wondering whether, if we are from our end here to pursue this, what are your thoughts about, methodology, about how to frame the question? Who has done significant work on sexual health within context of conflict and displacement? And also looking at the context of the region, the other, I think, group that would be really important to look at, because of vulnerability and because they're always under the radar and because of poor access, etc. I mean, the drill, is actually migrant women, and particularly migrant women domestic workers in our region. So I was wondering about your thoughts and about kind of what are the research lines, questions to think about, methodologies to think about. So that was my question.
Well, thank you very much for that question. I think that's a very, very important question. But I have to say, I think you are the leaders on that question. You should not be asking me that question because you are the ones who are actually doing work on that. I will actually would love to hear more from you. I mean, you are in a region which unfortunately is historically also related with a number of crises, with conflict, constant conflict, with displacement, with migration. And I think there's no one better than yourself in your work to not only understand the phenomenon, but also to understand better what are the major concerns related to sexual health, of course, also to sexual rights, because as you said, particularly, I would say women and younger people are more vulnerable, definitely, in these conflicts, in these situations. And we know about
I guess,
a number of
Dr.
violations.
Yeah, I guess I wanted to pick your brain perhaps on, you know, methodologies to look at, to investigate sexual health in within groups with extreme and various level of intersectional vulnerabilities, where it's a bit more difficult. So, you know, I mean, it doesn't, we could, it's something that we can.
But let me, thank you for that. This is also important for me in terms of reflection. I think that qualitative studies will be probably more informative than quantitative studies. Of course, let me say that most of what I do is more quantitative than qualitative. But I think unless you have enough already data, qualitative data that will in a way make you more knowledgeable about exactly what are the most important phenomena and the dimensions, and so you could move into a more systematic quantitative data collection. But I would say that qualitative studies will be definitely more important to begin with. But again, there are always mixed methods approach. So I think also the other important thing in terms of methodology, of course, not sure if this is possible with these populations, but of course it will be very important to if you have still access to those populations over time, longitudinally. Of course, if you want to make inferences about impact in their lives over time, making sure that you are able to connect with those participants in the long run, or at least 1 year later or 2 years later might be important. I'm not sure if that is possible or realistic, but that will be also, of course, an important aspect in terms of making inferences about impact in the long term, not only associations. But other than that, I cannot think about many other suggestions for me. I mean, I'm not an expert on that field, and I actually compliment you for working on that area, which is so important. You know, we or in Portugal, we are privileged to live in a country with relatively safe country, and so with no conflict for a long time period. So you are the ones who have to teach us, I'll say. And it's very important for us to learn with you.
Pedro, this will be a great idea to think about collaborative work, I think, with Pedro and the University of Porto. Thank you, Pedro. I have a question from our friend Ana Maria Giraldi, who was the past president of the International Society of Sexual Medicine. What do you think the chicken and the egg in the Japanese study? Key risk factors for mortality, which also are risk factors for lack of interest. Interesting.
Good point. Yes. Yeah. Thank you, Ana Maria. And great. I don't see you, but thank you for making the questions. Always great. I think this, of course, when we talk about associations between sexual health and other aspects of health, and in this case, mortality or survival or longevity, we should ask for what is the cause and effect. And of course, they are mutually related and they influence each other, definitely. There's no doubt about that. There's a number of studies that show that. But one important thing when we do longitudinal studies, and as far as I read the study, the Japanese study, I may be mistaken, but I think that was the case. Since they assessed, in that specific case, they assess, I guess, sexual interest, if I'm not mistaken. They assessed sexual interest at time point 1 or 0, let's say. And then they were assessing a number of aspects, not only of diseases, but also mortality along the way. And so if we do this, at least to this component, if we introduce sexual interest at time point 0 and assess what is happening in other aspects of life, including mortality, then we are relatively, we can, with relatively confidence, would say that at least at some certain level, sexual interest is predicting all-cause mortality across these years, regardless of the other way around, which definitely also exists. So, but again, all of this is strongly associated. All of this determines the other, and I'm not just saying that sexual health determines everything else. It's closely connected, but these studies show that at least to some level, sexual health indicators do determine and do predict important aspects of life across time, and that is, I think that's a very strong evidence, and we should use that evidence to promote the importance of sexual health.
We have a question from the floor.
Yeah. Okay. Hi. All these percentages were concerned about. I mean, were about Japan, or I misunderstood? And in that case, why they chose Japan for these statistics? Why Japanese population?
Well, what I share was not only Japan. This was one particular study in Japan, but there's all the studies, actually most of them in Europe, I guess in Germany, in the Netherlands, and those studies were important because all of those studies used large samples, population representative samples in a way, diverse samples. And also all of those studies use longitudinal design, so we are able to understand the impact of sexual health dimensions over time in other aspects. So it was not only Japan, but also one of the biggest studies in terms of sample was conducted in Japan, yes.
Thank you very much, Pedro. We really enjoyed it. And thank you for sharing this wealth of data and knowledge. And also congratulations for your day in the university. I know you had
Thank you very much.
Long, busy day.
Thank you, yes.
I'm sure we're gonna meet up in person, hopefully in the university here in Beirut. And I wish you a very pleasant weekend. Thank you very much.
Thank you very much. Thank you very much.
And thank you all
Thank
for
you.
attending this meeting, and looking forward to see you all and more of you, hopefully in the next talk. Bye-bye. Thank you very much.